Welcome to DEFCON 3. I'm KT McFarland. Congress is getting pushback from the White House and the Attorney General over the Veterans Affairs healthcare scandal. Representative Jeff Miller, he's chairman of the House Veterans Affairs Committee. He's demanding answers from the Obama administration. He's joined us today to explain. Mr. Chairman, I can't believe it. We have a scandal where Americans are dying because they're being put on, in effect, wait lists that are really death lists. You're the chairman of the Veterans Affairs Committee, and you have asked the United States government, the Attorney General and the White House for some answers. And they're stonewalling you. How can they do that?
Well, the unfortunate thing is the Department of Veterans Affairs has been stonewalling us for a number of years. But then when it appears that there's criminality involved, we ask the Attorney General to become involved. We've heard nothing. Of course, it took the President 3 weeks before he actually engaged and came out and acknowledged that this was just not an isolated incident at Phoenix. It was a systemic problem throughout the entire agency.
And so what's the next step? Is everybody just going to put you on hold until they get a new Veterans Affairs Secretary?
No, and that was one of the things that concerned a lot of us about Secretary Shinseki stepping down. We did not want him to leave as the only solution to the problem. He's not. I mean, it's much bigger than the Secretary. And I can assure you that the House Committee on Veterans Affairs is going to continue to focus intently, as we have in our oversight role. We invite the Senate to become involved in what we've been doing. We've had 42 oversight hearings in the 113th Congress on issues that involve not only wait times, but disability backlog claims. The Senate's had 7. They need to get engaged as well. The White House needs to answer questions, especially the Attorney General, and I hope that Sloan Gibson, the acting secretary, will do the right thing, and that is continue to keep the focus on the bureaucracy.
You know, I don't get it. I mean, who in America is in favor of having American veterans die because they're not getting adequate medical care?
Nobody.
And so how do you get stonewalled? How do the Democrats, how does the Senate say, no, we don't have time to deal with this, while Americans are dying every single day because they're not getting
Well, the
adequate
amazing
care?
thing is there was a lot of discussion about this great compromise that was reached by Bernie Sanders, the chairman of the committee, when 90% of what the compromise was House-passed legislation that we've already sent over to the Senate. There's 12 bills, 9 of which have been languishing for months over there, and it would be nice if the Senate would work in tandem with the House. We'll work with them, and we'll work with the White House. We can't fail. We can't fail America's veterans because they didn't fail us.
Yeah, one of the things in Washington has been known for years. I mean, when I was in the Reagan administration, the Veterans Agency, the Veterans Affairs, was always called the soul-sucking agency because as a veteran, you kind of get thrown in there, and who knows what happens to you. But usually not anything very good. Why is it that people have said, well, we just got a new Veterans Affairs Secretary and that'll solve it? You mentioned that it's much bigger than this and much deeper. What could be done to fix it once and for all?
Well, one of the things is accountability. We've been asking for months now about who was held accountable for the deaths that occurred in Georgia and South Carolina because of dues to delay in care. Men got terminal cancer that was not being able to be treated because they were on wait lists. 5,000 men at one time were on a wait list when they had the ability to send them out for non-VA care. And so accountability is important. Obviously, transparency is critical if we are going to work together as a co-equal branch of government. Our committee has worked in a bipartisan way. I worked with our ranking member. The subpoenas that we have put forward have all been unanimous, most of the moves that we've taken place, because I don't want it to be called a political football in what we've been trying to do. This is important for the veterans that put on the uniform of this country, that expect us to serve them after they've served us.
I can't understand how we're not getting to the bottom of this. But let me ask you, people have said, okay, we've got a crisis now, we don't have enough doctors, we have these death lists. How about just taking those veterans and putting them into private health care as a stopgap measure? Let them go see the doctors they need to see today. Is that a realistic
Well,
option?
the president talked about having a pen and a telephone, that he could do a lot of things if Congress wouldn't do it. If he would have just taken his pen when this thing first broke and said, I am giving the authority to the Department of Veterans Affairs to send veterans anywhere they want to go to get rid of this backlog, that would have been a great thing. I mean, I'm not big on signing statements. I'm certainly not big on executive orders. However, that would have been one that he probably should have done. No, not probably. He should have done that. And the other thing is, what's more egregious is that they had the ability to do it. They had some hoops to go through, but there was no reason for any veteran to be on a wait list because they could have been sent out for non-VA care anyway. The law has allowed that for over a decade.
You're not going to let this stop, right? You're not
No.
going to, even though the public attention will move on to the next scandal, you're doggedly going to go after this, aren't you?
Yeah,
Can you promise to the American
I promise
people?
the American people, and I've said that, and I've told the president this, we are not going to quit because America expects more out of the Congress than what they have been getting in years past and all of the political infighting that's been going on. We need to work together to solve this problem, and it's not one that's going to be solved overnight. That's why I've asked the president to lay out a vision for the Department of Veterans Affairs for years to come, not just what we have seen in the past, and that is growing a bloated bureaucracy, especially in the middle management level that knows they're going to be there a lot longer than the president's going to be in office.
It's time to fire some people and hold them accountable. Well, thank you. I'm sure you're going to do that. Congressman and Chairman of the House Veterans Affairs Committee, Congressman Jeff Miller from the great state of Florida. Thanks for joining us. That's it for DEFCON 3.